experience we have in our practice every day, and it's like a very great movie style here, and present all these works we have in our personal experience. I want to present this A1 software experience because, like we have some guess about the patients. Talking with some friends, retinologists, says, why you want to make this work? Because we can find all what want in clinic examination. And I said, but sometimes we have some guess about retinal detachment or no imprimaturs. And we want to know about this software A1. It's because the determination of the reflectivity of the tissues can make it by the spikes in the standardized ecography. Like in the standardized we have one software, A1, who have an selective function where we can find if this membrane we will study is really a retinal detachment or it's only a membrane. But sometimes in adult patients it's not so easy to make it, and in a pediatric patient it's very, very hard to try to find well this membrane. Like we know, it's possible to start one scanning without B mode, and we can do it like here in the picture to try to find the double spike who is compatible with retinal detachment. Yes, we can do it, and sometimes with some training, it's so easy to find it. The present study is an observational and descriptive study made in different places because we have a lot of patients, pediatrics, and it's not so easy to find in some only places because we have some hospitals of ophthalmology with a third level, and it's not common to arrive patients with pediatric retinopathy premature. We made it with standardized quantal equipment, and first, the retinology made the clinical examination, and after, we made the ultrasonography, B mode, and posterior, the A scan with the software A1. We included 47 patients, 98. We excluded patients with troubles in the corneal tissue because we cannot do it the clinical examination of the funduscopy. We included 22 male, 25 female. This is the origin of the patients, 41 from Mexico City and the rest other places of Mexico. We have this weight of the patients, and the main was the last with 1001, the beginning of the weight. This is the regarding gestation period. The main is 25 to 29 weeks, 34 patients. And this is according the birth of the patients that we included. And we don't have a 1, 2, or 3 retinopathy premature stage. We have in stage 4, 3 patients, and in stage 5, 80 patients. Well, what we found that in B mode, 2 cases corresponding to hyaloids and 1 case with correspondence to tractional retinal detachment. In standardized A1, all presents membrane 2 crosses. That means we don't found any A1 positive retinal detachment. This is the results of the stage 4, yes? And all the membranes emerged from the optic nerve that we report, and all were found like hyaloids. In the 5th stage, the ecographical findings in B mode, we had 33 cases that 75% had a membrane to emerge of the optic nerve, yes, and all showed the 100% retinal compatible reflectivity. That means there's a positive A1 results. But in the other 11 cases, we have 7 cases that have double spike and 100% reflectivity with retina. That means we stay in the same with the clinic results. But only in 4 cases, we don't have this compatibility. We ask why we don't found these A1 results positives to routine. Well, we have this because we suspect all these patients have a chronic retinal detachment more than 3 months, and that means maybe if the retinal detachment is not recently, maybe can change the morphology of the tissue, and that means we don't have one A1 positive results. The standardization one was determined that 3 patients present dental suggests of membrane, and should be noted these patients had more than 3 months of suspected retinal detachment. That means maybe if it's chronic, maybe change the results. And why we made this study? Like you make some scanning of the eye, and we don't find exactly all the membranes, and it's a disorder inside the eye, and this is a helpful tool to find results. And sometimes in pediatric patients, it's not easy to make the scan. Like it's not easy, really easy to find this. In the phase stage, we determined by MOI-B the presence of an emergent membrane of the optic nerve in the form of B and have some movability. But in the 90%, we found a closed funnel to emerge of the optic nerve, and it go compatibility with retinal detachment. These some examples of the positive retinal detachment in A1 and positive to cross. Other cases with a disorder inside the eye, and we cannot find so well the retinal detachment or another membranes, and sometimes the vitreous has a minimal hemorrhagic or some condensed vitreous. The clinical findings were concordant with the clinical examination, but sometimes we had some doubtful diagnosis and was confirmed by ultrasound. We concluded that the ultrasound is a very useful tool, and it's an accessible tool. We can do it, the scanning. But the trouble is, in all the equipments, we don't have the A1 function, and it's not so easy finding other equipments. And this is a trouble because we only have sometimes the A scan, but not standardized, and few cases we have the A1 scan. But why is the main reason I made this study or I make this work? This is the main reason. One patient I began to make this work is Leah Valeria. I made the scan maybe 6-7 years ago, and like we will see, we saw this image. I don't know if one of you have some guess about the result. I think it's so very conclude it's a retinal detachment. We don't have any guess. But the time passed, and I followed Leah Valeria, and one day arrives the mom. She have now 6 years, and she said the mother, Leah runs so well. Leah, look the colors. She can tell you it is pink, it is yellow, and she can play with other girls of the school. And I said, come on, but here is the result. In this moment, I don't have one A1 standardized, but I don't have any guess about the result. No? And the mother said, oh, doctor, this is a miracle. Look. And I said, no, this is a mistake, maybe. And I don't was the only one who examined the patient. The retinology and the mother want to ask another opinion, and all of the medical doctors we examined Valeria, we don't have any guess. And I said, well, sometimes we have concluded so good diagnosis, and this is not the truth. What I can learn, we need to do and occupy all the tools we have, and it's possible for a better diagnosis of the patient. And sometimes we have all the tools and don't be useful for us, or we don't want to learn about that. This is my small experience with A1 standardized, and well, I want to say thank you all of you for your participation in this SIDUO. Thank you very much.